everyone and welcome to Rad Chat. My name's Jo McNamara and I'm joined by fellow host Norman Joy Anderson.
Hi everyone.
So here we are live at UKIO 2025 and we're in the pod box and we've finally managed to drag Ruth in kicking and screaming. Well, not quite. But Ruth, we've been wanting to get you on the podcast for a while. So Would you like to formally introduce yourself please to the audience?
I shall. And first of all, sorry about that. I think last year and the year before you tried to get me in here, but it's just been so busy. So my name's Ruth Strudwick. I'm a professor in Diagnostic Radiography at the University of Suffolk and head of allied health professions, amongst other things. Do quite a lot for the College of Radiographers, and I'm quite busy here at UKIO.
So tell us a little bit about your career. What got you into the profession?
Well, so when I was 12, I fractured my wrist. And I was really fascinated by what the diagnostic radiographer was doing. And I wanted to know a little bit more. Thought it was great that they were using all this equipment but also working with people. So that was lodged in my brain. Didn't really come back to it because I was 12 years old and you don't know what you want to do then. Always thought when I was younger I wanted to be a teacher. And actually, ironically, I've kind of combined everything together in one role. So when I was 16, I did work experience, as you do when you're doing your GCSEs, and did a week's work experience at my local hospital. I was really lucky to get a week, actually, with the radiographers, and just loved it and felt it was really something I'd like to do. So probably that concreted my ideas. And then obviously went and did my degree. I actually moved away from home, so I grew up in Buckinghamshire, but I went to Ipswich as a student. And ironically, I now lead the programme that I was a student on, so that's quite bizarre. Worked as a radiographer for about 8 years, diagnostic radiographer, did every sort of different imaging modality, never specialised. I loved the variety, but I found that I had quite a good aptitude for teaching students and really loved working with them. And I did a bit of training, so I did moving and handling training and basic life support training, and quite liked the whole hands-on teaching. So then I became a practice educator, and then a job came up at the local university as a lecturer, and I thought, I'll go for it, because they didn't come up very often, and I got the job. And then basically I've kind of moved my way up. On average, spent about 7 years in each role, so 7 years as a lecturer, about 7 years as a senior lecturer, about 7 years as an associate professor, and then went for professor, and at my third attempt I was successful.
Congratulations.
So it took a little while to get there, but I always say just make the most of the opportunities you're given. So for me it was trying not to say no, but thinking, how can I fit that in, because that would be a really exciting thing to do.
What do you think is the best part of diagnostic radiography?
So for me, it's about making a difference to every patient every day. And if you think about each patient that you see, as a diagnostic radiographer, you're producing an image that hopefully helps to make a difference to their future pathway, either diagnosing what's wrong with them, or finding out there's nothing wrong with them as such, on the images, but making a difference to them by the way you talk to them, by the way you care for them, and just thinking about them as an individual, but also working with this tech. It's amazing, the sort of tech that we work with. So it's that whole, it's the best job in the world, because you talk to people all day, but you can make a difference to them.
I would argue therapeutic radiography is the best job in the world, just saying.
I think both both have their definite. I teach therapeutic radiographers as well, and I think they play a key role as well in treating patients and making a difference to their prognosis as well. So I definitely agree with you there. Maybe they're equal.
Yeah.
Should we agree on that?
We can agree on that, absolutely. So Ruth, in terms of academia, what do you think are some of the kind of challenges facing you at the moment?
Yeah, so obviously everybody knows about the financial challenges, and I'm sure anyone who works in higher education will know that there's been lots of restructures, voluntary severance, lots of things like that going on, which obviously puts pressure on us because we're still keen to get a good experience for our students. I think more recently, since the pandemic, there's been certain differences in perhaps the way people are in terms of their learnt communication skills and professionalism, which means that we need to work with our students to help them to grasp that and understand that, and that's definitely changed in the time I've been in academia. So it's really different now. You can't say to a student, oh, stand in front of the mirror in your uniform, do you look professional? They don't really have anything to hang that on. They don't really understand what that means. So we've been doing quite a lot of workshops with our students about what is professionalism, you know, should you have your phone out or not, making eye contact, like just learning how to make small talk with people that perhaps they haven't had the opportunity to do that. So in the past where students came in and they'd had a part-time job, they maybe haven't had that opportunity just to talk to people, and so they find that really hard. So we're kind of starting from a different perspective, I guess. Doesn't mean they don't have the potential, they just maybe never had that opportunity. And I think AI is a big thing for us as well in terms of how it's been used by students. So I think it's really important to be open about AI and how it can be used helpfully, but how it shouldn't be used to replace you doing your own work. So it can be useful in terms of research, but then like using that to move forward in terms of your work. So those are some of the main things, I think. But I still love teaching students and I learn so much from them. You know, it's really important that as an educator you're open to what your students are saying as well, rather than just thinking I know everything, but actually they teach me stuff every day because they look at things from a different perspective.
It's a really good point. Sorry, just to go back on like the professionalism. I remember my lecturer taught me how to answer the phone. It's such a simple skill. I remember going to clinical practice, picking up and saying hello, like it's my mobile. So you can't do that. You say your name, who you are, like what your
Absolutely.
If you're a student or not, where you are.
And we've had students come on the course who've never been on public transport before because they just haven't had that opportunity, and then they're scared of it because they don't really know what to expect. That was definitely a thing straight after the pandemic because people had been stuck at home and they didn't have that chance to do things. So we just need to be empathetic and understand it from their point of view and think, what can we do to support these people? Because they clearly have the potential, but they just haven't had the opportunity.
I do always remember the first lecture I delivered after COVID, and you know, all the restrictions had been lifted. And I was like, you know, you're all back, it's great to all be here. And I looked out and it was so interesting because everyone was so spread out. And it was just like, they just had never, even though they'd seen each other online, they were just scared of being
It was really
around
strange,
each other.
wasn't it?
Yeah,
like
really
that
strange.
first thing, when someone gave you a hug and you're thinking, am I allowed to do that? And like, so I've got a bank contract, so I did some bank work. And during the pandemic, you know, when you were wearing PPE, and like it's really hard to work as a radiographer and not get up close and personal to your patient, you know, and the people who have hearing impairments, when you've got a mask on, you know, a few times I'd say to them, are you happy for me to take my mask off and step right back and then speak to them so that they could lip read? It's really, really hard. A lot of stuff that we learn, I guess, that we rely on so much, don't we?
Yeah, I remember doing on-treatment reviews for the telephone and realising I can't see your reaction to what I'm asking you, how you're feeling. It was completely different, but it's amazing how it's adapted to online meetings, things like that.
I mean, Teams has its place, absolutely does, and it's revolutionised a lot of things in terms of not travelling, but sometimes you just can't replicate seeing someone's body language and understanding how they are.
What do you think are the next big opportunities for academia, HEIs?
I mean, I think there's a lot of diversity and innovation in terms of education and providing that, you know, so thinking about that blended curriculum that probably we never did before the pandemic because we didn't have the software or the opportunity to do that. But I think it's really important that we maintain the quality. If you think about UK radiographers, they're the best in the world really in terms of our education system, and we shouldn't dilute that. So I'm not saying we shouldn't have innovation, but I think it's really important that we maintain the quality of our provision, and we're proud of how good our radiographers are in this country, because if you think about it, when you go to other countries, you know, our qualification is recognised pretty much all over the world, maybe different in the US, but generally with a UK qualification you can work anywhere, and I think we should remember that and think about, you know, how we keep that standard.
Any students listening to this podcast episode, what advice would you give them nearing qualification?
I think don't ever lose sight of why you became a radiographer and what your role is in terms of making a difference to them. I say that all the time, we should be making a difference to every single patient. try not to lose sight of that despite cuts, pressure, workload. Every patient should be treated uniquely, and you should always have a dialogue with them about how to co-produce what you're doing. So it shouldn't be you doing something to somebody. It's about understanding what's important to them and then working with them. I always give the example, a patient comes in a wheelchair, don't assume they can't walk. It may be it's a long way from the car park and they're really breathless, but actually they're perfectly capable of standing up. So you need to say to them, we need to get you on the bed. How's the best way to do that? What help can I give to you? And they might say, I'm perfectly fine to do it, or actually I need you to help me. But if you don't ask that question, you don't know. So don't ever lose sight of why you wanted to become a radiographer, and hopefully that's to make a difference to people.
Thank you very much. It's been great. Really nice to chat to you finally.
Thank you.